Today in this video we will be discussing how to approach a patient presenting with chronic abdominal pain. Normally a patient with chronic abdominal pain is very difficult to evaluate because there are a number of causes which can cause chronic abdominal pain, but it has been seen that in almost 2% of the cases it is caused by psychological disorders. So it is very important to differentiate between any organic cause which is causing chronic abdominal pain from the other psychological causes. So normally chronic abdominal pain or undiagnosed chronic abdominal pain is said to occur when a patient presents with abdominal pain for more than 3 months and there is no definite diagnosis in spite of all the investigations done. Now, in the first step of evaluation, it is important to find out the source of the chronic abdominal pain. If we think of any visceral pain, the first source of chronic abdominal pain can lie in the stomach. In the stomach, peptic ulcer disease or any gastric tumors can cause chronic abdominal pain. So to evaluate this, we can go for an endoscopy or upper GI series. Next, the other organ that can cause chronic abdominal pain is the small intestine. In the small intestine, there can be inflammation or there can be tumors or obstruction. So to evaluate all these conditions, we can go for an ultrasound a whole abdomen, then we can go for a CT abdomen or a CT enterolysis. So in the small intestine there can be inflammation, tumors or obstruction causing chronic abdominal pain, and that can be evaluated by these investigations. Now the next organ that can cause chronic abdominal pain is the pancreas. In the pancreas there can be pancreatitis. So it can be acute pancreatitis or it can be chronic pancreatitis. Then there can also be presence of tumors or presence of cyst that can cause chronic abdominal pain. To evaluate this, we can go for an ultrasound of the abdomen, then we can go for a CT abdomen or we can go for an ERCP. With that, we should also go for a pancreatic enzyme test. So all these investigations can lead to the diagnosis of any problem in the pancreas like pancreatitis acute or chronic, tumors and the cyst which may cause chronic abdominal pain. Now the next organ is the hepatobiliary system. In the hepatobiliary system, the most important diseases which can cause chronic abdominal pain is the gallstone disease, then there can be biliary obstruction or there can be tumors, cyst, or there can be hepatic diseases like hepatitis, or there can be hepatic veins engorgement. So all these diseases in the hepatobiliary system can cause chronic abdominal pain, and to evaluate this we can go for an ultrasound of the abdomen, then we can go for the liver function test, then we can also go for CT abdomen, and not but the least we can go for the liver biopsy. If the other investigations doesn't give a proper diagnosis, at last we can go for a liver biopsy to diagnose the different diseases which can cause chronic abdominal pain. Now the next organ that can cause chronic abdominal pain is the renal system. In the renal system there can be pyelonephritis, or there can be tumors, or there can be cyst. So all these problems in the renal system can cause chronic abdominal pain. Here we can go for ultrasound of the KUB, that is kidney, ureter and the bladder. We can go for a CT abdomen, or we can go for IV pyelography. So these are the investigations which will diagnose any problem in the renal system that can cause chronic abdominal pain. Now the next organ is the large intestine or the colon. Here some of the problems like obstruction or inflammation or tumors can cause chronic abdominal pain, and to diagnose any problem in the large intestine we can go for a colonoscopy, or we can go for a barium enema. So these are the various organs coming from the stomach, the small intestine, the pancreas, hepatobiliary system and the bowel, and all these any problem in these systems can cause chronic abdominal pain. And the various investigations that we have already discussed, these investigations can lead to the definitive diagnosis of any problem in these systems. Now the next source of chronic abdominal pain may lie in the abdominal wall. In the abdominal wall there can be certain problems which can be misdiagnosed as pain originating from the viscera, but it is important to note that certain problems in the abdominal wall can cause chronic abdominal pain. Of this problem, the most important is nerve entrapment or radicular pain. Radicular pain originating from T7 to T12. So in this spinal segments, any kind of nerve entrapment can cause radicular pain, which can come or refer to the abdomen, and ultimately it can lead to chronic abdominal pain. And many of a times it is seen that the pain is in the abdominal wall, but by thinking that it is coming from the viscera, most of the investigations are unusually done. Now chronic abdominal pain can also occur because of the irritation of the spinal nerves, because of the disc lesions or vertebral lesions, or it can occur because of the irritation of the spinal nerves because of diabetes or Tabes dorsalis, which is seen in syphilis, or it can also occur because of post-herpetic neuralgia. So these are the various causes of radicular pain which can originate as chronic abdominal pain, but it is origin is mainly in the abdominal wall. It can be because of nerve entrapment in T7 T12, or because of the irritation of spinal nerves because of disc or vertebral lesions, or because of some other diseases like diabetes or syphilis or post-herpetic neuralgia. Now the next source of chronic abdominal pain can be pelvic source. And the pelvic source can arise from three parts. One, it can be ovarian or uterine tumors. Next, the next common pelvic source is the pelvic inflammatory disease, and another can be endometriosis. So these are the three pelvic sources of chronic abdominal pain. So ovarian and uterine tumors as well as pelvic inflammatory disease and endometriosis can lead to chronic abdominal pain. Now, if the source is inapparent or still the diagnosis of the source of the chronic abdominal pain is not clear, then we have to rule out some of the other causes. Among these important causes, we have to look for any kind of tumors or cyst or any inflammatory process in the mesentery, omentum or in the retroperitoneum. So in an inapparent source, we have to look for any kind of tumor, cyst, inflammatory processes going on in the mesentery, omentum or retroperitoneum, and for that we have to do a ultrasonography of the abdomen, a CT abdomen, or we may need a laparotomy or laparoscopy. So we have to rule out any kind of tumor, cyst, inflammation or infection going on in mesentery, omentum or retroperitoneum, and for that we need an ultrasound, CT, laparotomy or laparoscopy. Now, if the source is inapparent, then we have also to think for metabolic causes. Among the metabolic causes, the most common can be acute intermittent porphyria. Then chronic abdominal pain can also occur in hypercalcemia, in hypo or hyperthyroidism, and also in acute adrenal insufficiency. So these are most common metabolic causes which can cause chronic abdominal pain. There can also be some of the rare metabolic causes like hereditary angioedema. There can be Mediterranean fever or diabetic neuropathy or carcinoid syndrome. So these are some of the rare metabolic causes which can also cause chronic abdominal pain. So it's important that we rule out all of the metabolic causes if the cause of chronic abdominal pain is inapparent or undiagnosed. Sometimes drug effect like lead toxicity can also cause chronic abdominal pain. So a patient with inapparent cause, we have to rule out lead toxicity. Now we have already discussed that in 2% of the cases it can be functional. So among the functional, the most common cause is the irritable bowel syndrome. There can also be non-ulcer dyspepsia, or there can be post-cholecystectomy syndrome. So these are some of the common functional causes that can lead to chronic abdominal pain in most of the population. So lastly, another important cause of chronic abdominal pain that is missed out is the vasculitis or chronic mesenteric ischemia. So in this disease, usually the patient feel dull, crampy abdominal pain in the first hour of eating. So it is one of the most common symptoms that whenever a patient takes food, within the first hour he feels a dull, crampy abdomen pain in the upper part of the abdomen. So it usually signifies some form of vasculitis going on in the mesenteric arteries, or there can be a chronic mesenteric ischemia. And to diagnose this disorder, we always need an angiography of the abdominal blood vessels. we have discussed a lot of common causes of chronic abdominal pain. We have also discussed how to rule out the various causes of chronic abdominal pain, how to look for the visceral pain or the pain originating from abdominal wall, or the other various type of functional and metabolic causes. Hope you are benefited from this video. See you all in the next video. Thank you.